Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. Today, I'm going to talk about some of the back to school safety for our children. Now, I have had done this before and I have produced several educational videos about back to school safety for the children, students, high school students, middle school, also going to the college. Today mainly I am going to concentrate about the kindergarten allergies because these kids are just going to start either kindergarten or first grade, and before they start the seasons, this before this the children, family, parents, caretaker, they should be aware of the children going to school with a proper nutrition, proper allergies, and vaccines. There are so much updated vaccines available, and I have mentioned that in my previous videos, and they are all submitted to the YouTube through Bloomfield Township website. So now this is the introduction as the school starts this fall for young children, whether they are teens, college age. Our parents are busy preparing their children for back to school. In order to have a successful back to school season, parents should also always consider school immunization, vaccines, their nutrition, as well any allergies. And I will discuss the tips to a successful school years for our children with the proper precautions and obtained by them as well as for the school they are going to, and it should be a proper communication with the school personals. Next slide, please. So our children may face several allergies. Common allergies include food allergies, environment allergies, contact such as eczema, inhalation allergies like asthma. Just knowing the fact that some children are asthmatic, and when they go to school, there is a different environment and they can have a wheezing episode. So managing a child's allergies can be difficult for both the child as well as their parents and the caretakers. So follow the guideline of American Academy of Pediatrics. This is a recent guideline that has been published by the Academy of Pediatrics regarding the allergies. So there are some highlights that include Benadryl, epinephrine. The emergency drugs that should be available are Benadryl, the epinephrine. Maintain a clean, allergy-free environment, and also personal clearance, like personal hygiene. Important is like washing hand thoroughly. There should be create a detailed allergy plan. There should be a work collaborative with your child's doctors, teachers, caretakers, and they should create a detailed allergic action plan. An effective allergy action plan, what does it include? It includes a clear identification, first of all, name tag of the child, a clear identification of the allergies that they are subjected to, as well what are the emergency contact, the medication detail, school and caretaker instruction, emergency protocol, and any other protocol that the school might follow for, for can follow for their record. So, what are the food allergies? I'm going to spend some time with the food allergies because these are the kids. When they are born, they are allergic to milk protein, cow's milk protein, and later on, those allergies build up. It build up. So, I went through a lot of researches that have been done about food allergies from different institutions like John Hopkins, the Harvard, and they are all included in my bibliography. Food allergies, it affects 10% of the children globally, and I was surprised. Next slide, please. So, what are the food allergies? Starting first from the milk. Milk is a good source of allergies. Eggs, peanuts, and the tree nuts, wheat, ragweed, soya, and lastly the shellfish. These are the common offenders that affect our children, causing allergic reaction in them. And in the beginning, they have not, the IgE antibody is not built up. And so these kids, especially the kindergartens, when they go to school and they are subjected to any one of them, and they can develop a serious reaction. This list is not exclusive, and each child has a different allergen. It is important to get your child tested before they start the school in order to know exactly what is the common offender in for them. Next slide, please. So now, what happens about the milk allergy? Infants who are born with a allergy to cow's milk, they have a high chance of developing asthma compared to their non-allergic counterpart. Next slide, please. So, what do you do? I mentioned all the allergy, all the factors that causes. The best way to prevent allergic reaction is avoid the triggering and allergens. Another way to manage an allergic reaction is through oral immunotherapy, which has been going on for some time. And this is a burning topic these days. Oral immunotherapy that includes a gradually introducing a small amount of allergens to a child to build the tolerance. However, if an allergic reaction does occur, there are a few medical treatments available. The common medical treatments available are epinephrine injection. Epinephrine injection works very good because it cuts down the allergy right away. It causes a vasodilatation, and inhalation of albuterol, which is a beta 2 agonist. I don't want to go into detail about the beta agonist, but just so that our community, our listener know that albuterol is very important, something that you can cause the vasodilatation, and it relaxes the smooth muscles of the bronchi, the airway passage, and it helps breathing better. It improves the breathing. So there should be a combination of both albuterol and the epinephrine in the school. They should be available by the school system. Next slide, please. So parents, how should they meet all the criteria? Parents should discuss their child's allergies. First of all, very important, with the teachers, the school administrative team. Educate yourself on how your child's school handles allergy at the classroom. Next slide, please. So, by creating a safe living and learning environment, by addressing the physical and the emotional safety needs, a healthy eating, very important, good nutrition diet, a good habit, a good hygiene are critical. Getting the proper amount of sleep is very important, and children should aim to get at least 8 to 10 hours of sleep per night. The most of the information that I have obtained was the Center for Disease Control, CDC, American Academy of Pediatrics, the NIH, National Institute of Health, and the Science Direct. A couple of slides have been prepared from the Open Science. So for any information regarding the schools, allergy, flu, all these things becomes a necessity. They're important for the. I have mentioned a lot about the flu seasons, and also about the flu vaccines. The two flu vaccines that are very important for our students to get is the flu vaccine. The flu vaccine is very important, and there are different ingredients of this vaccine. The Pfizer vaccines, vaccines, and the different kind of vaccines are available, and they help to prevent they help before the school starts the vaccine. The children should also be updated with all the routine immunization, and it has been, I have illustrated it diagram wise about the routine immunizations according to the age, to the children, the adolescent, and the college going student. The very important to get the flu vaccines, because as soon as the kids start school, they are exposed to a lot of other kids. Some of the kids might not have received a complete vaccination. The children, they bring those viruses with them home, and they suffer with the allergic symptoms like sneezing, cough, cold, and all that, and they also spread it around in their family. Very important for senior citizens. The senior citizens taking care of their children with the with little ones who go to school. Senior citizens should be adequately immunized. They should receive the proper vaccine. Now, after reading through a lot of recent advances in vaccination, as well the detail about the Moderna vaccines and all that, I do not want to go to the detail, but so that we know there are different kinds of COVID virus. They change their character, and they affect our children and the adults in a different way. Some of the COVID vaccines vaccines have different side effects. Some are more potent, some are more dangerous. And the new form of the COVID vaccine is they don't have the horns. So what happens, this COVID virus, it just goes to the tracheal mucosa and goes to the lungs, and right away causing the symptoms of bronchitis, pneumonia, and more. So one should be very careful. Always check with your primary care physicians, with your internist, with your pediatrician about what is the new nature COVID vaccines that are being given, and also the new flu vaccines, and they should be updated with those. So in order to have a complete good academic year at a school, these are some of the following guidelines that I have provided, and this is the third series of my lecture on the back to school safety. All these have been updated, including the burning topics, what I hear from the CNN, the Public Health Services, CDC, and I have included those in the bibliography. Now I like to, so the back to school season can be hectic, stressful time for work. So there are few tips more. Create a safe living and a learning environment by addressing physical and emotional needs. Healthy eating habits and a good hygiene are critical. And also, lastly, get a proper amount of sleep. Children should aim to get at least 8 to 10 hours of sleep per night so they are fresh the next day. And I'd like to thank you for listening to my podcast today, which is about managing allergies among your children. So, this is very important for back to school safety during fall. Thank you very much.